Cancer has a severe impact on millions around the world every year, and that is why World Cancer Day on the 4th of February is an important day to unite, to spread love and support, and most importantly, raise awareness and funds as well around cancer. And this morning we are chatting to Alana James, the CEO of the Sunflower Fund, who we know all too well, and Simone Ekstien, the director of the Independent Community Pharmacy Association, on their collaborative efforts to bring together communities to educate people about fighting blood diseases specifically. Ladies, you are both amazing human beings, and it makes us so proud to be connecting with you this morning. Good morning, how are you?
Hi, good morning. Always absolutely amazing to spend some time with you guys. Thanks for having us.
We are absolutely super.
We are so happy to be able to connect with both of you today. Alana, I'll start with you. We discussed this for Health Tuesdays on Tuesday, but maybe you can elaborate on this. What is the significance of World Cancer Day?
So World Cancer Day for us is it's really important because it's a time where we create awareness about cancers, about diagnosis. And, you know, one of the biggest challenges we have is just awareness and education. So World Cancer Day really brings that recognition to the table. It helps people, visit their doctor for early diagnosis. It helps them understand what their family and friends and communities are going through and how you can still support and maybe even save their life.
I.e. by becoming a donor, as I am, and hopefully many more people will be after this. The Sunflower Fund works incredibly hard, Alana, at recruiting donors for a number of blood diseases. Can you tell us a bit more about the Sunflower Fund's mission and what are some of the biggest challenges you are currently facing?
So our biggest goal is to really see patients being able to get to transplant. And so for somebody who's got a diagnosis of a blood disease or a blood disorder, for many of them, their only chance of survival is a stem cell transplant for which they need a matching donor. So every day, our efforts at the Sunflower Fund and our partners are there to recruit those stem cell donors to potentially be a match for someone.
I met a young patient who had already survived leukemia once and then had contracted it or had gone back into that state. And after that, realizing that you could literally save someone's life, that you could be that hero, that person that gets to save another person's life by doing something that, let's be honest, doesn't require a huge amount of you. That's no question. So I really do hope more people will rally to that cause.
Simone, I'm going to let you weigh in on the conversation as well. Maybe you can tell us about the ICPA and also the partnership that you have with the Sunflower Fund.
So the Independent Community Pharmacy Association is an organization which provides pharmacies which are owner-managed and your typical mom-and-pop pharmacies with a collective strength and a coherent voice that is heard by government, the medical schemes, pharmaceutical suppliers, and most importantly, our patients and our patrons. The ICPA represents roughly 1,100 owner-managed pharmacies and one of the largest pools of professionals in the healthcare sector. It is not just about selling TOPEs, which is an acronym for Tubes of Hope, with the Sunflower Fund during August and September of each year. Our pharmacy teams campaigns amongst each other, our staff, our patients, and within our communities, obviously, to say, remember, I'm hope. You can be the hope to save somebody's life. I personally signed up as a stem cell donor, and I'm so proud of it. And I love to have the conversations with our patients to say, and to give them the positive affirmations to remember, I'm courageous, I'm brave, I'm strong.
Simone, I've got to ask you, because you're obviously representing, I love that, the mom and pop stores out there, but pharmacies really do form a central part of our communities. Why is it so important for you to work with these pharmacies in the communities in South Africa?
We partner to bring our communities together to educate the people around blood diseases like leukemia, as mentioned by Alana. And remember, our reach is far more than just urban. It is deeply, deeply rural. Often your patients that don't have access to your typical digital media forms, things like that. So we have conversations with patients and we have conversations about what they can do as a a single person to give someone hope.
Alana, I want to throw it back to you because you mentioned this earlier. Now, you said 1 in 100,000 chance of finding a donor. What exactly does it mean? How does that work? And what are you looking for when finding a match?
So we always try and explain it as what you're looking for is your genetic twin out there, which means that somebody with your same sort of hereditary background, your same ancestry. So we always talk about South Africa being this most amazing rainbow nation because we've got such diversity in culture. If you're looking for a genetic twin out there, it is incredibly difficult because that diversity means your chances of finding a match are even greater. So we have to encourage donors from potential donors and matches from every single walk of life, from every culture group. And that's where our partnership with ICPA is so critical and so important because, as Simone was saying, they reach out to the communities. And to be able to spread this message and this education so vast is fantastic for us.
An opportunity for South Africa to stand up and help each other. How do we do it? Very quickly, how can we get involved to make that change?
So really easily, you zip onto the Sunflower Fund website and you see what the criteria are, and they're really simple. And it'll take you under 2 minutes to register as a stem cell donor. And because of COVID and all the challenges that we faced, a wonderful system has been put in place where we'll actually deliver your swab kit to your home or your office address. It's a brief swab in each cheek. That's it. And send that back to us. And that's it. That's the process to register as a donor.
As easy as that.
I love
Simone, Alana, thank you so much for joining us today and also for sharing some insight on this for World Cancer Day.
We really do appreciate it, the efforts of a host of people around this time, but every day of the year, in fact. And together, I think we can fight life-threatening blood disorders and bring awareness and change to our communities. But the key word, together. We need a community to stand up now. And you can be somebody's hope for life by registering to be a stem cell donor. As you've heard, it is so easy. You can also donate money or you can offer your time and your expertise as a volunteer. But visit sunflowerfund.org to find out literally how you can change someone's life forever.